Assalamualaikum warahmatullahi wabarakatuh. My name is Nonali Farzana and I will be presenting about a case of life-threatening supraventricular tachycardia storm associated with theophylline toxicity. Firstly, we will be going to introduction. The definition of SVT, or known as supraventricular tachycardia, is a type of arrhythmia which characterized by an abnormally fast heart rate originating from atria upper chambers of heart. The characteristic of this SVT is heart rate range from 120 to 200 beats per minute and can reach high as 300 ppm. And it is usually present with recurrent episodes of tachycardia, which often increase in frequency and severity with time. In this case, theophylline toxicity and supraventricular tachycardia are interconnected conditions that can arise from the effects of theophylline. Theophylline is a medication that primarily used for respiratory disease like asthma and chronic obstructive pulmonary disease, or known as COPD. This toxicity can occur due to acute overdose or chronic medication, which lead to significant health complications. Cardiac arrhythmia, including SVT and multifocal atrial tachycardia, is one of the complications of theophylline toxicity. Next, we will be going to patient chief complaints and patient information. In this case, a 76-year-old man was referred to hospital due to worsening dyspnea because of smoking history. Dyspnea is a difficult, painful breathing or shortness of breath. And the patient information stated that the patient has a blood pressure was 121/63, which high than normal blood pressure, and then the pulse was 192 bpm, which indicates SVT. And then thirdly, chest x-ray demonstrated towards patient and indicate acute pulmonary edema with cardiac enlargement. Fourth, the patient has elevated of N-terminal probrain natriuretic peptide concentration. And fifth, transthoracic echocardiogram revealed global severe hypokinesis of left ventricle with reduced left ventricular ejection fraction of 20%. And lastly, the patient information is LV end-diastolic diameter was 54 mm, which is big. Next is medical or surgical history. A 76-year-old man had a history of smoking, and this person had been taking medication for chronic obstructive pulmonary disease for 3 months, including theophylline 200 mg twice a day with long-acting beta antagonist inhaler. And this patient also had never experienced heart palpitation. Here is ECG finding from this patient with explanation. Firstly, what we can find is that SVT ventricular heart rate of 211 beats per minute, and then regular tachycardia of narrow QRS complex at 211 bpm, and the P waves are not visible due to being buried in preceding T waves retrograde as often seen in SVT. And this ECG also found normal axis on limb leads. And lastly, this ECG shows that subtle XT segment depression in some leads, which can be secondary to rate-related ischemia or toxicity. Furthermore, what are the management for this patient? Firstly, this patient had managed by blood test at 15 hours after admission. Then, it showed multi-organ dysfunction with acute renal failure and acute hepatic dysfunction. Also, this patient had arterial blood gas analysis, which under 10 liter per minute. Oxygen by mass showed metabolic acidosis with results this 4, which is firstly is pH of 6.977, PCO2 of 40.6, PO2 of 85.5, and lactic acid level of 18. Despite from that, what are the treatment for this patient? Firstly, this patient had right heart catheterization, which is a mechanical circulatory support, shows right atrial pressure is 12 mm Hg, means pulmonary artery pressure is 40 mm Hg. Secondly, this patient had percutaneous cardiopulmonary support, which percutaneous cannulation of left femoral artery and vein. And this patient also had continuous hemodiafiltration to remove theophylline, and intravenous verapamil infusion for effective suppression of SVT. Other than that, this patient had catheter ablation, which to maintain sinus rhythm to ensure sporadic atrial extrasystole disappeared, and also coronary angiography, which results showed no significant stenosis in major coronary arteries, and lastly, this patient had radiofrequency catheter ablation for accessory pathway and any tachycardia could not be induced. What are the discussion for these cases? Firstly, rare case of SVT storm leading to tachycardia-induced cardiomyopathy and cardiovascular disease. It is managed with mechanical circulatory support (PCPS) and continuous hemodiafiltration (CHDF). What are the clinical manifestations of theophylline toxicity? It is divided into three groups. Firstly is mild toxicity, secondly is severe toxicity, and lastly chronic intoxication. For mild toxicity, this patient can have the symptoms of nausea and vomiting. For severe toxicity, this patient will having cardiac arrhythmias, seizures, and death. And lastly, chronic intoxication. It is a severe symptoms like arrhythmias, which can occur even at relatively low theophylline levels. Moreover, what are the mechanisms of arrhythmias in theophylline toxicity? This theophylline toxicity enhances atrial automaticity and intracardiac conduction, and it increases risk of atrial fibrillation, SVT, and multifocal atrial tachycardia. The treatment for theophylline toxicity divided into two groups, which is mild cases and severe cases. For mild cases, the patient could having activated charcoal and bowel irrigation, but for severe cases, the patient needs to treat by hemodialysis or hemoperfusion, which are recommended by Massachusetts Poison Control for seizures or arrhythmias, and CHDF, which used to lower theophylline concentration and suppress in SVT in this case. The management of SVT divided into two groups also, which is usual treatments and severe cases. For usual treatments, the patient can be treated by vagal maneuvers, pharmacological treatment with adenosine, and adenosine effective in more than 90% of cases which involve in AV node dependent reentrant circuits. For the severe cases, adenosine was ineffective due to high theophylline level, competitive inhibition at A1 receptor, and other contributing factors acidosis, hypoxemia, excess catecholamines, and lastly, SVT recurrence was promoted by atrial extrasystole from theophylline toxicity. Role of mechanical circulatory support is used to stabilize hemodynamics in refractory cardiogenic shock or tachyarrhythmias, and it is necessary until theophylline levels normalize via CHDF and rarely required for SVT in adults, which more commonly reported in pediatric populations. Lastly is SWOT, which stands for strength, weakness, opportunities, and trait. For the strength of these cases, it provides valuable clinical insight into management of SVT associated with theophylline toxicity, and it is utilized case study formal, which allows for detailed examination of patient management strategies, treatment outcomes, and interplay between different medical conditions, which can enhance understanding for clinicians. Weaknesses in this case is a single case report, which findings may not broadly applicable to all patients with similar condition, and it is not provide extensive statistical data or comparative studies that could be strengthened evidence based for findings presented. And the opportunities for these cases need further research into effects of theophylline and its interactions with cardiac arrhythmias, and this case could contribute to develop clinical guidelines for managing patients with SVT which related to medication toxicity. This can improve patient care protocols. And lastly is traits. Traits of these cases is if clinicians do not recognize the signs of theophylline toxicity early, patients may face severe complications which indicate a threat to patient safety. And in this case also, the traits are changes in treatment protocols or medication may affect how similar cases are managed in future, which potential rendering some findings less relevant over time. In conclusion, this rare case of SVT storm is associated with theophylline toxicity that resulted in tachycardia-induced cardiomyopathy with cardiovascular collapse. The experience suggests that SVT is refractory or life-threatening under specific conditions such as theophylline toxicity. Mechanical circulatory support should be used in case of life-threatening SVT storm associated with theophylline toxicity. Effective management strategies for SVT associated with theophylline toxicity, including pharmacological interventions and potential need for advanced therapies such as catheter ablation. And that's all from me. Thank you. Bye.